Foreskin piercings, pros, cons, advantages, disadvantages. Coming up next on Pros and Cons by a Piercer, episode number 80. So stick around. For those who are new to the channel, my name is DaVo. I'm a professional body piercer and have been since 1994. I own and I operate the Axiom Body Piercing Studio located here in beautiful Des Moines, Iowa, inside Skin Kitchen Tattoo. So, when I talk to you about these things, I'm telling you a level of expertise as someone who's been in the industry for well over 26 years and has done a number of these piercings. Before we get too far into this, I need to explain or kind of give you a little bit of a disclaimer. I'm going to be talking about a male genital piercing. I'm going to be talking about male genitals, anatomy, and etc. If you do not want to learn about that, or talk about that, or hear about that, or hear me talk about it, then this isn't the video for you. If you are not of an appropriate age to be watching something in your part of the world that revolves around these type of piercings, this is not the video for you. If you are looking for some type of titillating sexual excitement, this is not the video for you. The whole purpose of this video is to educate those considering getting this piercing done, and possibly their partners, or somebody who's curious about it. It's solely educational. With this out of the way, let's talk about what exactly a foreskin piercing is. Foreskin piercings are done through the foreskin, usually horizontally, just like any other lobe. They're done kind of like an earlobe, so that one part of the ring is inside, the other part is outside. These are usually done with rings. They can be done with curved barbells or barbells in some cases. It really depends on what the wearer's long-term goals are, so to speak. But traditionally, they are done with rings. So let's start in. I'm going to give you 5 pros, 5 cons, 5 advantages, 5 disadvantages. Starting with the pros. Pro number 1, this can increase sexual sensitivity. Because it is located in a very sensitive part of the body, most people will find this stimulating. It's been often called the clitoral hood of the male genital world, piercing world anyway. However, like with any piercing that's done through the genitals, it is one of those things where it may be exciting at first and may fade over time. Everybody's different. Everybody reacts to different sensations differently. And over time, that sensation will become less exciting and new and more mundane and normal. Like I always say with genital piercings, it may not improve it. It probably won't make it worse, but it'll definitely make it different. And that varies from person to person. So results vary. Understand that going in. Number 2, this piercing usually has a very quick heal, usually healing out in roughly about 6 to 8 weeks. I generally suggest that if you're sexually active, that you treat it as a healing piercing for a minimum of 3 months. This is a long-established piercing. In fact, this piercing dates back to ancient Rome, when it was used as a form of infibulation. Basically, it's kind of an odd form of chastity. Basically, what they would do is they would mark it and then pierce through both sides of the foreskin. Then they would take a piece of thread and put it through it, and then over time tighten it so that it would pretty much seal it up, thus making it much more difficult for the person who has had this done to get stimulated enough to complete a sexual act. Now, I know I'm going to get asked this in the comments at some point. Yeah, do I suggest using the foreskin piercings as a form of chastity? No, I don't. You're putting a lot of pressure on 2 pieces of jewelry through thin tissue. There's always a possibility of damaging the piercing if you connect both of them and then get excited. Anyway, it is going to heal. There's a long history of this piercing healing with little or no issues. Number 4, lots of placement options. This can be done pretty much anywhere on that rim of foreskin. It can be placed on the top side. The two sides is kind of the traditional, but it can also be done on the top and the bottom. Some people have done multiple ones, which is often called a king's crown or a magic crown, or there's a bunch of different names for it. And I'm blanking on what the particular one is with this one, but they can be done so that you have multiple piercings on that area. Number 5, this piercing can be hidden very easily. With genital piercings, unless you are active with someone as a sexual partner or you tell people, there is no reason why they would know that you have this piercing. Flat out, it's easy to hide. If you're working a conservative job or you live in a conservative part of the world, it's a good option because it's one of those things that you can hide easily and enjoy like piercing should be, but you're not going to have to worry about any social stigma that may be attached to being pierced in your particular status in life, or stature in life. So that brings us on to the cons, the disadvantages, the things that aren't so great. Number 1, anatomy. If you live in the United States, chances are you're probably circumcised. That means that you do not have the anatomy to get this piercing because there is no foreskin left to pierce it. However, there are people that have used various sort of methods to kind of reconstruct or regrow foreskin. In some cases, not always, but in some cases, it can be pierced. That is really comes down to whether or not you have the anatomy to do it safely and not have issues. Varies from person to person. But usually, if you're uncut and the tissue is loose enough to fit the jewelry in there, it isn't an issue to get this done, but you have to have your foreskin attached. Number 2, these can bleed anywhere from 3 to 5 days. Any genital piercing will do this, regardless of which one it is. It will require some additional precautions to make sure that you don't stain clothing and etc. Usually I suggest wearing a sanitary napkin, and I'll get a little bit more into that when we get into the piercing experience and healing and etc. Number 3, if the piercing or if the placement of the piercing or the jewelry is incorrect, this piercing can be very uncomfortable when you get an erection. The reason being is if there's not enough room left, it will cause kind of a pinching sensation because as the tissue expands and contracts, there's not enough room there for the jewelry. Also, if it's placed at an odd angle, this can cause an issue. If it's not just straight through, it is very important that you find a skilled piercer that can read your anatomy, understands how this piercing works, and has done a great number of them. It's not one of those piercings that I would suggest an amateur or someone new to apprenticeship or whatever to do. It's kind of slightly more advanced, especially in the United States where you really don't have that many opportunities to do it. It's kind of more of a rarer piercing than it should be. And for that reason, I would be really diligent about researching the person that's going to be doing your piercing and whether or not they've done a lot of these. Number 4, with any male genital piercing, for the most part, anything that's on the shaft or around the glands of the penis, some partners are just going to find it uncomfortable and require you to remove it during intercourse. Everybody's different. Sometimes it's all in their mind. Sometimes it is just plain uncomfortable. Understand that going in. This is why if you're in a committed relationship, you should discuss this with your partner before you do it. Number 5, risk of STDs. Any genital piercing, regardless of where it's at, because you have hard metal through soft tissue, even after it heals, there's always a possibility during intercourse, especially piercings like this that are going to get a lot more contact, to have slight tears or in the piercing, and then you have an exchange of a virus and then catch an STD. It's very important that whenever you switch partners that you practice safe sex the way you're supposed to, which means latex barriers. And I'll get a little bit more into that. What are we going to do? Healing and living with the piercing. So with the pros and cons out of the way, let's talk about the piercing experience itself. Usually with this piercing, most people say it's a slight pinch. The actual piercing, almost all genital piercing is kind of an intense initial pain and then nothing. Unlike, like let's say a earlobe or even a nostril, where you have that throbbing and aching immediately afterwards. With genital piercings, you kind of don't have that. It's kind of, ow, God, that hurts, and then over. Of course, if you bump it or catch it or what have you, then it's not going to feel so good. But for the most part, you don't have that throbbing and aching immediately afterwards. The forceps can be fairly uncomfortable, just basically because it is very sensitive tissue. And if the person puts it on too tight or something gets caught there, it doesn't feel good. Usually, I will try to limit the amount of pressure the forceps have. It's more about bending out the tissue and getting it into position to do the piercing and supporting the tissue during it. But for some people, the forceps can be fairly uncomfortable. Now it moves us on to healing. Average healing time on these, I would say, is probably about 6 to 8 weeks. However, I do suggest treating it like a healing piercing for a minimum of 3 months, especially if you're sexually active. That's going to involve cleaning it twice a day with sterile saline solution. Personally, I like Nelmed piercing aftercare because you can just basically spray it on there, let it sit on for about 5 to 10 minutes till it melts away whatever's on there, discharge, etc., and then just wipe it clean with a sterile piece of gauze sponge or a clean paper towel. Do not use Q-tips or cotton balls or anything else you can find in the medicine cabinet. You need something that doesn't have strands of fiber that are going to get in contact and wrap around the jewelry or stick to the piercing. Safe sex for a minimum of 6 months after getting the piercing done. I don't care how long you've been with the partner, because the piercing will kind of it goes through 2 stages. The healing stage, where it produces tissue around the jewelry to the point where it is no longer an open wound. Then it will take additional time for it to strengthen the piercing. During that first 6 months, it's most at risk to tears in exchange of bacteria. Now, both you and your partner, I guess it could be partners, have obviously been tested. You know you're both clean. You're fine there. What I'm more concerned about during that first 6 months is an exchange of just plain old, good old-fashioned bacteria. We all have our own little messy bunch of them, our own colony that we carry around with us, and usually those are going to be a foreign pathogen to you. So just to avoid infection, I do suggest practicing safe sex using some type of latex barrier for a minimum of 6 months. Last one would be, of course, cross-contamination prevention. I can go into that in depth, but basically it's pretty simple. It's just like every other piercing. Wash your hands before you handle it. No oral contact or exchange of bodily fluids, which I already talked about. Keeping your environment clean, clothing, bedding, towels. Not submerging the piercing in bodies of water you cannot control the quality of, which is pretty much everything but your own clean bathtub. I absolutely don't suggest swimming while healing a piercing. Also, keep pets away from it. Do not let them sleep in the bed with you. They're just germ magnets, and they're going to drag every germ they have into your bed and spread it all over the place. Ugh. Anyway, also, because this does bleed sometimes 3 to 5 days, you do want to wear some type of sanitary napkin or pad to cut down the likelihood of staining clothing, but also it adds kind of a little bit of cushioning during that initial tender phase. It can also help cut down the amount of moisture in the area, which then cuts down the amount of bacteria in the area, which kind of helps fight off infection. Now let's move on to living with the piercing. This piercing, once it heals, usually isn't a big hassle. Of course, you have to practice safe sex, as I mentioned already, 3 times now? When you switch partners, make sure you're both tested, go through the whole 6-month period, do it the way you're supposed to, and you should be fine. But, you're at a higher risk, and you need to understand that, and it's very important that you do that. The only other thing I could say about living with a piercing is it doesn't really interrupt much of anything else. Sometimes you can get caught on clothing. You do kind of have these 2 rings kind of hanging out there and just asking to be caught on stuff. Just be cautious. You should be fine. So that's it. That's everything I have to say about Foreskin's pros and cons. Hope you enjoyed the video. Hope you found it edifying. If you have any questions, please comment. If you haven't already, subscribe, hit that notification bell so that you're notified every single time we post something. And it's always a good idea to like it, because we like it when you like it, and it helps kind of spread the word. If you like merch, you like t-shirts, you like phone cases, you like leggings, check out our merch store. Links in the description. There's also one of those merch things at the bottom. Till next time, here's hoping all your piercings heal with ease and without a single issue. And if you're in the Des Moines, Iowa area, I hope to see if your body piercing needs in the future. Have a good day, everybody. Thank you for watching.